It's a good case for practice. For teaching. For teaching, it's a good case. So I ask you, ladies and gentlemen, now because of the shortage of time, we may not be able to more cases or more detailed treatments, but I think we can discuss treatment strategies here. So what would you recommend to this lady? She wants to, which lines do you want treatment for, madam? Yeah. So her main concern also, she's pointing to her glabella, and also she pointed first to the lower part of the face. So that's a more of a concern because she can possibly, as you can see, she has a slight fringe. She has some hair here, so she can possibly hide her glabella with the fringe, but she cannot hide the lower part of the face. She'll have to wear a veil to do that, but she doesn't want that. She pointed first to the lower part of the face. So, what would you recommend here? For the lower part of the face, what would you do? Idea is to start on this side. Right, what would you do, sir? I ask you, what would you do to this lady? She has, there's a labial folds, she has very deep marionette lines, she has a tiny bit of facial sagging. So what would you do?
I would use deep filler.
Yeah.
For deep lips.
Yeah. So will you do
a little bit volume?
Yeah, I agree. I agree completely that you will do the wrinkles first. Now, some volume needs replacing. Now, when you say volume augmentation, I use that as a different concept. Let me show you what I mean. If you look at the lateral side of her face, she has a dimple here. There's a hollowness here. Can you see that? Can everybody see it? So this will be ideal for volume augmentation, so the cheek becomes nice and round. So, but also equally she has wrinkles where you will be injecting intradermally into the deep dermis. I agree. So you will treat them both. And what would you do for the forehead lines and the glabella? Will you do now? Let me show you. If I do this now, just relax, man. If I do this, you can see very deep lines, glabella frown lines. So what will you do here? You will first of all do botulinum toxin, but equally you have to tell the patient that this may not be enough because these lines are quite deep. In about a week's time, 10 days, 2 weeks, she will come back. These lines will be a little bit softer, but you will still be able to see them because there is clear dermal epidermal fracture line on either side. So what will be your option there? I ask you, somebody at the back.
So first of all, you put some botulinum toxin for
We are past that stage. She has got her botulinum toxin, she's gone home, and she come back today after 10 days. So you can still see these lines. She says, I can still see these lines. So what would you do for her then?
Just some filler.
Yeah, which filler would you use?
Usually I'm using Juvéderm.
Yeah, I don't like Juvéderm because of the fact, not because of the brand name or anything. It's not a very good product for glabella. Glabella is a very dangerous place, as I showed you in the anatomical slides. I will use Uma Juenesse velvet here, very carefully. And velvet. Velvet. Uma Juenesse velvet. It's an ideal product. If I can have a box of velvet here, please. No, that's not velvet. That's ultra. Perfect. So that's velvet. That's 16 milligrams cross-linked for non-cross-linked. So I will put that here. And still she said, now she has a fringe. She has a fringe. She has hair. So she can hide her forehead. If she comes back and says that she would like these forehead lines doing, so what would be your first line of treatment? Ladies at the back, the front. Anyway, we will do botulinum toxin for the forehead lines also, the first instance, and if she comes back and says, I'm not happy with the lines, I can still see them, then put either velvet or maybe ultra into it. For the lower part of the face, so we're past that, the lower part of the face, and the nasolabial folds, we can treat her with, which product will you use here? Can you pass me Ultra, please? Gracias. So which product will you use? They're fairly deep lines. Yeah, classic or ultra with lidocaine. So you don't have to give her any local anesthetic. So I will use that. So, madam, are you happy for me to treat your lower face first? And then we will see. And if we have some time left, we will see if we can do some Dysport also. If we have time left. Is that okay, madam? Please lie down. So she is elected to have the lower part of her face treated first. Now we're starting with the lower part of the face because she is elected to be treated there first.
Открытый макияж.
No. Good. Very good. Danke. Bin? Is there a bin here? So I need a. Yeah. Okay, madam. Just relax. You are absolutely fine. So what I will try to do is I have only one ultra. I have only one ultra. And the syringe is marked 0.1, 2, 3, 4, 5, 6, 7, 8, 10. So you can easily see how much volume you're using. Yeah, so there is a little pearl there. Is this dry? Thank you. Okay, madam, just relax. What I'm going to do is inject a tiny bit of the product, leave it there for about 60 seconds, and then the local anesthetic will start working. Is that okay? That's between. Right. Even I understood that. No, I didn't. Okay, just relax. Okay, so we start here. 45-degree angle, lift. But don't inject too much. There is already product there. And I'm in deep dermis here. All done. And now don't inject anymore. Now, you remember this morning I was telling you about ladies who have lots of fine lines over a large surface area. You could do cross-hatching here using velvet, 1 mil on either side. So I'll leave that to you, okay? So here, don't do anything until you've seen her in a week's time. And the volume I've injected is, no idea, it's about 0.2. So now I will inject the other marionette line before I go to, can I come on the other side? Right, okay, man, yeah, that's perfect. So, okay, sharp scratch. There we are. Okay. Are you okay? Are you in pain?
Yeah.
Good. So you can carry on working slowly, and as lidocaine keeps getting released into the tissues, the patient has no pain. She's fine. A tiny bit of mounted bleeding. Just compress it a bit. Disperse. See, the angle of her mouth is turned down. Let's see if we can lift it a bit. Okay. There we are. So that's exactly where I was hoping to be. Tiny amount. Don't inject too much, please. There is a tiny bit of a lift, but I will not be tempted to inject too much here at this stage. Just gentle massage, and we go to the nasolabial fold. Now we don't have much product here, but we will do our best. Still. It's very good. Only inject a tiny amount. Yeah. That's it. No. So now gentle massage there. There's a fair bit of product there, so when you do this massage, there is maxilla underneath, and it can be painful. So just be gentle, not too hard. Hold on. Press it. No, you don't need to. We'll do it ourselves. Okay? Right. Now I'm going to do the other nasolabial fold. Yeah, I need to go to the other side. Sorry about this. Excuse me, ladies. So, I still have, shall we say, 0.2 mil. I've done 2 marionette lines, 1 nasolabial fold, and I still have 0.2 mil. Are you impressed? Okay, that's good. But in all fairness, some patients who have very deep wrinkles will need more product. Here I would say she will need probably 1.5 mil or something like that. Yeah? Already there is product there. And then the last bit. That's it, all done. Not too much product. Now, in this case, see her in about 10 days' time. And if she needs any more work doing, can you chuck it in the sharp spin, please? So, this looks already very nice. Okay, that's very good. Because of the fact that this lady, do you smoke? No, good. She has fairly deep lines. As you can see, the effect is quite good. So don't be tempted to put too much product in there at this stage, because then you don't know how she will react. See her in about 10 days' time. Something needs doing. Explain it to the patient that it will cost a little bit more at that time, because we cannot put too much product all at once. Yeah. And do it in a stepwise manner, and the effect is great. You can come and sit, madam. Just wait, please. Right, please. And just face the audience. Just look that way. Just look that way. So what do you think? I'm just. So what do you think? Because she has very deep wrinkles already. I haven't put too much product. This is a case which requires about 1.5 mils of ultra, but I've only used 1 mil, carefully. So I'll advise you to do the same thing and treat her in a stepwise manner. And now at this stage, if you want to do some botulinum toxin, if we had the time, we could have done it. That's about it.
Is it binding some water or staying the same water?
As I said, it's uncoiled, and all hyaluronic acid is hydrophilic. Now, hydrophilic means that as long as hyaluronic acid molecule is intact, it will bind water and it will stay there. 4, 6, 8, 10 months. And as soon as you start breaking it down, then the water will also. By then, 8, 10 months have passed. So you're not terribly bothered. The patient has received value for money. You are happy, the patient's happy. Who cares? Thank you, madam. Wonderful. Thank you.